Today's NBC4 News at 7.
And good evening, everyone. I'm Colleen Williams. It is the next big step in the vaccine rollout, but it's one that has some parents divided. Children as young as 5 years old have now been approved by the CDC to get the Pfizer vaccine. Joining us right now is Dr. Richard Cabrera, a pediatrician with Beverly Hospital in Montebello. Doctor, first of all, thank you for joining us tonight.
Oh, you're welcome.
Is this a situation where all kids above the age of 5 should get the vaccine, or should some parents wait on this?
So it's a bit of a complex answer. Part of it is for the individual, part of it is for the community as a whole. Kids are still getting COVID. Kids are being hospitalized, and they're being exposed from outside of the house, and they're bringing it in. So much like every other vaccine that we have, we want to give it to kids to prevent them from getting sick. In addition, the added bonus is it stops the spread of the disease to others.
We're talking specifically about Pfizer at this point. Is there any reason at all for families to wait for the Moderna version?
We don't know when that one's going to be authorized or FDA approved. I would say the current one has been approved, and in terms of the risk studies for Pfizer, nobody had any severe reaction or anaphylaxis for the 5 to 11 years age group.
Do you find it interesting because even parents who are vaxxed here or double vaxxed have some reluctance about getting shots for their kids? What would you say to them to get them off the fence?
Well, it's going to be hard because every parent has a different reason why they choose to vaccinate or not vaccinate. I myself have gotten my third booster because I'm at a higher risk. I think it's just important that if you're sending your kid to school, there's a chance that they could get COVID. So we have a vaccine that would prevent that. The risks of severe disease are much smaller in pediatrics, but kids still do end up hospitalized, and the benefits far outweigh any negative side effects of the vaccine.
No doubt parents will be watching their children very closely if and when they take them in for a shot. So what can I expect as a parent? What sort of side effects might kids see?
So it's very similar to other vaccines. Most likely side effect is pain at the injection site, sometimes redness, fever for 1 day. We recommend Tylenol or ibuprofen. I think in the past they didn't recommend NSAIDs, but either one is fine for pain relief after a vaccine. But most kids actually have no reaction, just like any other vaccine.
So, doctor, will young children, that age group 5 to 11, will they come in and get the shot from their pediatricians? Will they be able to go to some of the other areas where their parents or older siblings have gotten their shots? How does that work?
There are resources online. I don't have it at MyVax, or there are websites where you can schedule a visit, and it'll give you the age ranges of each site and where they're available. I work at Beverly Hospital, and we're going to be starting to give that vaccine soon. Patients can sign up either with us or through the website.
All right, Dr. Cabrera, as you said, Beverly Hospital in Montebello, thank you so much for your time and your expertise this evening. All right.
Good night.
You too. Take care. We also want to remind you that